Hello, everyone. You're listening to this week's episode of the Health Me Podcast, episode number 44. Thanks for tuning in to this week's episode, and if you haven't subscribed already, please do so and leave a like so that way this information gets out to as many people as possible. This week's episode, we have a conversation with a doctor of clinical psychology to discuss the topic of anxiety and depression. More specifically, we discuss the role anxiety has played in our current world and how psychologists play a huge part in allowing you to develop a relationship with this often overwhelming emotion. In addition, we discuss an emerging area of concern for many women across the world, and that is postpartum anxiety or depression. It goes without saying, I learned so much during this episode, and I was completely humbled to some of the issues that can occur post-pregnancy. Please enjoy my conversation with Dr. Lisa Slover. Well, it's obviously been an interesting 2 years, to say the least, for everybody. And talking about anxiety and depression has certainly been more normalized compared to probably years prior. Of course, this doesn't always lead to people getting help. And in your experience, have you noticed a rise in people getting help, or are you seeing similar numbers as before?
I actually am seeing people reaching out for help more now. And I think that's because there's a lot more availability for help. Things like Talkspace, a lot of those apps are now becoming just very normal, where you can go on, choose a therapist and pretty much see somebody same day, same hour. And so I think that it's much more accessible and people are feeling less stigma for just saying, hey, I need some help. And I think that's really, really awesome.
Now, do you think people's emotional intelligence is also improving? I think when I was younger, when I first felt anxiety, I wasn't really sure exactly what it was and how to actually express it or even put a language to what I was feeling. And do you think, in addition to obviously more resources and perhaps social norms talking about it, do you think people are becoming more emotionally intelligent and figuring out what it actually is? Or do you think it's just a product of more accessibility and normalization? Or what do you think?
Yeah, so I think that anxiety is becoming much more prevalent now because of the last couple of years. I think that with COVID and all of the things that has brought for us is that there's a lot of uncertainty, and anxiety kind of breeds from uncertainty. And so I think that, yeah, we're all just feeling it. We're feeling that what's next, what's around the corner. Housing, physical health, jobs, all of that is just very uncertain. And so I think that everybody's feeling more anxious now. And that as a result, we're all talking about it more, which I think is great.
Likewise, I think it's the more we talk about it, the more opportunities we are able to share ideas and figure out what we need to do in order to help solve some of these issues. You also mentioned that there's a continuum of anxiety and levels of anxiety. And you also said that it's kind of normal to experience anxiety, which is great. It's a normal part of our biology. Maybe just describe a little bit more what this continuum of anxiety is, maybe from the extremes of just normal everyday feeling anxious about maybe just driving, or maybe talking about just chronic anxiety that you feel every day from the time that you wake up to the time you go to bed.
Yeah, so absolutely. There's a huge spectrum of anxiety. And yes, I think that all of us have some anxiety equipped in us, things like taking an exam or doing a public speech. I think most of us do feel those nerves. But then we have anxiety that completely disrupts somebody's life, where, like you said, the moment they wake up to the moment they go to bed, they're feeling that fight or flight, that, heart racing. They feel like a tiger's right around the corner. And then there's obviously the middle, where it's disruptive, but they can still go on and do their daily life. And we call that high functioning anxiety. So something where they're feeling that on the verge of a panic attack every moment, but they're still able to go to work. They're still able to be with their friends. And there's definitely a very large spectrum of anxiety.
So at what point, and this was a question that I took from a poll of people that I asked about what kind of questions that they wanted to ask you. And, at what point does anxiety actually become diagnosable, right? Because if it's a normal biological drive in us, like at what point do we say, okay, I have anxiety? Well, it's like, at what point is that an actual like condition? So you guys speak to what your interpretation is of like when something becomes like almost like a diagnosable an impairment.
Yeah, so that's a good question. And I think it's different for each person. And some people do really, really well with loads of anxiety and they're like, nope, doesn't affect my life in any way. And then there's some people who definitely feel every single minute of anxiety. And so the way that we diagnose a disorder is by asking them, does this impact your life? Does this get in the way of the things that you enjoy? Does this get in the way of your relationships? And if they say yes, it does a lot, that's when we say, okay, this is diagnosable for sure.
And for those people who are maybe like high functioning, I mean, what kind of conversation are you having? Because, if you ask the question, is it affecting your daily activities? They're like, no, but they're like, I still don't feel good. So what would you say to people that are like maybe coming to you for help, but it doesn't affect them to the point of like destroying their life or destroying their relationships? I guess, what would you say for people who are maybe like high functioning people who have anxiety?
Yeah, so definitely I think that that's a moment where you have to really push them and you have to say, let's admit this to ourselves.
Mm.
Is this affecting you more than you think it is? And if they have a hard time admitting that it's affecting them, then we say, then that's kind of the problem, is like, why is it hard for you to admit that this might be affecting your life more than you're saying it is right now?
Mm.
And often when I see people in my office that are high functioning individuals, sometimes it's just me pushing them, like, are you sure, this would affect me? And, and once I push them, they're like, okay, yeah, this is really, really hard. And it's, really affecting my life.
Are there things anecdotally that maybe patients or people can look for to indicate perhaps they do have anxiety? So I know for me, in the past, it's been difficult to kind of label what I'm actually feeling. And so I can imagine if someone is also going about their day to day, they're really, really busy, don't even realize what they're feeling. I guess, are there things that people can maybe internalize or think about or even reflect on to say like, okay, maybe I should go get some help and figure out like what I'm feeling?
Yeah. So are more so like, what are the internal cues that people should look for?
Yeah, internal cues, whether it's physical or emotional, I suppose are the things that people need to be looking for.
Yeah. So I think anxiety is very characterized by racing thoughts. So
Mm.
I think most of us throughout our day, we're driving, we're doing the dishes, we're thinking about stuff. But what I often see with people with anxiety is that their brain is just kind of firing out all these different thoughts and it just does not stop throughout the day. They're thinking of their friend's text and then they're thinking of their work responsibility. And it's just constantly going and going and going. And they find they have very little mental rest. So I think that's a really, really big indicator that they're experiencing some anxiety. And especially if they keep coming back to the same thing over and over, day after day, week after week. So that's one. Another one is physically in the body. If they're noticing maybe their throat feels really tight or their heart's racing a lot, or maybe they just feel like the sense of dread in maybe places where they feel like they should be comfortable. Like I get a lot of clients, they come in, they say, I'm hanging out with my friends and all of a sudden I feel like there's something wrong. Like I feel like there's a threat around the corner. I don't know why, like what's wrong? And so things like that physically, I think are a really, really big cue that some anxiety is going on as well.
And on your side of treatment, are you trying to get them to identify those feelings and to help them work through them? Or is it, and just almost acknowledging that feeling? Or is it perhaps trying to get through it and getting on the other side of either living, maybe I should reword the question. Is it more about identifying anxiety to be able to live with it? Or is it more about being able to not feel anxiety more? Because I think I had said this earlier, people almost don't want to feel anxiety. However, if it's a normal part of us, I don't think it's my opinion that I think that it may be bad to try and like eliminate it entirely. And so is it more about just identifying and living with it, or is it more of trying to eliminate it entirely?
Yeah, I personally, I mean, different clinicians would probably have different opinions, but I
Mm-hmm.
personally believe we just have to make friends with it.
Mm.
That there's a very basic function for anxiety, and that anxiety actually feeds on anxiety. So
Right.
what we see with panic attacks is a lot of people are like, I'm panicked about having another panic attack. And, I always say, well, let's just make friends with that panic attack. Like, let's talk about it. What happens during a panic attack? Okay, your heart races, you feel like you can't breathe, you feel like you're gonna die sometimes. Like, let's just make friends with that, as uncomfortable as it is. And then I find that when people do that, there's less fear about having one. So that when you do have one, it's more of like, okay, I got this. Like, this is just going to be really uncomfortable for 20, 30 minutes, but okay, like I can get through this, and I'm not going to be scared of it happening again. And that's a really, really hard place to get to, of course. But, going back to anxiety, is if we can become friends with anxiety and realize its purpose, that it's almost like we have less anxiety. It's interesting how that works.
Yeah, it's you develop a relationship with it, and it's something that you didn't think was as bad. Just similar to exercise in my realm, some people who haven't exercised their entire life, they think it's this mountain they have to climb, and you show them one exercise, do it once every day. They're like, oh, it's not as bad as I thought it would be, which is, I think, interesting. In my realm for PT, one of the things that I have to do education wise is explain time frames for healing. So say someone comes in with like a rolled ankle, they say, hey, how long is this going to take? 8 to 12 weeks, whatever. Are you having that conversation with people? Are there expected time frames maybe in the research that indicate how long someone should be dealing with like diagnosable anxiety? Or I guess, what is a typical treatment time that you see patients for?
Yeah. So it really, really depends on each person. There really is no gold standard of, yep, you're going to be better in 2 months. I find that people who are more consistent with therapy, more consistent with kind of the assignments that maybe I give out, things like meditation, things like, resting, stuff like that, then people do recover or become more friendly with their symptoms than people who just kind of, come in once a month, or are not really like doing the hard work, which the hard work is really hard work. So I don't blame them in any way for not wanting to do it.
Sure.
But I guess in summary, people who really are like, okay, let's roll up our sleeves, let's do this, will see results much, much quicker.
And in the realm of medications, you said, seeing consistent therapies, are there medications that people are using to help get over their anxiety? Do you condone in medication use? I mean, the use of medication is kind of like iffy now, and in some instances. So I guess like, what is your opinion on using medication to help with anxiety? Is it certain instances, person by person case?
Yeah, so I think it's person by person case. I definitely do see the use of medication for anxiety, for depression. And that I think that a lot of mental disorders do come from a nature standpoint. So the neurochemicals in our brain, neurotransmitters in our brain, and a lot of those can be helped through medication. And so when I'm seeing a client, I'm getting their symptoms, how long they've been going on for, the severity. And if I have a client who's like, I've tried everything, I'm feeling really bad, I kind of want a quicker fix, because I don't want to say medication's a quick fix, because it's not. But I really need to feel better now. Then I often will say like, okay, let's refer you to a psychiatrist. We'll get them on board with your treatment, see what they think, and kind of go from there.
Is there a benefit to like getting that initial, like just needing, like, I need to feel better now? Or the people who like need that, like, I don't want to say quick fix because it sounds really like like almost like a drug addict, but is there a benefit to that? Or is it kind of just like a weaning off from this feeling of like, I need to feel better now?
Yeah, it's such a difficult question to answer, because there's benefits, I think, to immediately starting medication and doing that in conjunction with therapy. But then I also see the benefit of saying like, all right, let's see if I can change some patterns, kind of process some trauma, and then see how I feel then. Because my belief as a psychologist is that obviously talk therapy works, right? And so like, you just got to talk about it. You got to acknowledge, you got to process, you have to articulate your feelings, the crappy things that have happened in your life. And that really, without acknowledging that, I think that sometimes those patterns just continue through our life. And so medication does help, but sometimes I think medication can mask it a little bit. But again, it depends on each person.
Yeah, I agree. And for me too, if people ask for medication in regards to, not ask for medication, but like ask me, should I be taking medication? I say, I think it's more of an acute thing, more of a short-term fix, something to kind of get us over the hurdle, to get us to exercise. And I'm assuming it's the same thing for you, where the long-term solution is really going to be sticking to an exercise program or sticking to talk therapy and understanding and developing a relationship with anxiety.
For sure.
And when you're considering and just like having conversations with patients, you had mentioned that there are some biological drives that create anxiety in the brain, but I'm interested to know if environment has a huge role in the experience that you have when you're growing up. And does your parents have a huge play on the way you have a relationship with anxiety? The amount of friends that you have, does that correlate with anxiety? I guess, like, what's your experience, or what do you notice with that?
Yeah, so there really is no like percentage wise, I think. And I would say it's half and half. I don't think there's any studies that say like, oh, here it is.
Right.
I think that there's a huge influence on our environment, though. I think that the way that our parents grew up and the way they parent, the way that our community is, the way that our friend group is, if we experience any kind of trauma, how we process that trauma, all of that influences who we are today. And I think therapy is really great at kind of unraveling who we are. And like, we're almost like a lot of us are on autopilot. And it's like, oh, this is just who I am. And I really love to sit with people. I'm like, is this actually who you are? Or is this a defense mechanism? Is this a wall? And like, let's talk about it. Like, where did you get this belief from? Is this your belief, or is this your dad or your mom's belief? Is this a protection? And a lot of times people are like, oh my goodness, like I didn't even realize that belief was not actually what I believe today. And so then we talk about, all right, what are some options, or what are some alternatives? And but to go back to your question is, yeah, I think environment, parenting, all of that really has an impact on who we are today, for sure.
And for you, you're exploring people's minds and their previous experiences and their whole life as a whole, just like through conversation and language. For yourself, have you had to come to terms with, or at least explore your own issues of anxiety, if you do have them, or perhaps had to come face to face with some interesting points in your life where you're like, wow, this is something that I never noticed about myself before?
Oh yeah. Yeah. That's actually what got me into psychology, was kind of my own experience with anxiety and depression growing up, and kind of like, I got to figure myself out. So I went to school and learned everything about the mind, and was in therapy a lot of my childhood, adolescent life, and really had to examine myself. And I think it's an ongoing process, even to this day. I think it's an important thing, to really examine yourself and say, who am I? Am I living the best version of my life that I want? And how are the things that I'm doing affecting the people in my life? And how do I want to improve? Kind of that growth mindset of who we are is not who we're going to be in 5 years, 10 years, 20 years, and that we're constantly evolving, physically. I don't know too much about it, but I know like our cells are constantly, and our muscles are constantly regenerating. Like that's how our mind is too.
Right.
And kind of looking at it like that, it's like we should be constantly saying, who am I? Is this what I want to be? And then appreciating, who we are, and then saying, great, like I can change. I don't have to be this person forever.
Do you think, as a part of just growing as a person, there should be a point or a part of your life that you're talking with a therapist maybe once a month or once every 3 months, just to continue growing as a person mentally and to make sure that everything's working well in your mind?
Yeah, I think therapy is beneficial for everybody. I think that obviously if you're going through something difficult, a breakup, a death in the family, some anxiety, I think that obviously it's great to attend to that. But let's just say somebody's feeling great about their life and, maybe they want to learn more about themselves. Yeah, therapy is great for them too. I think therapy is great for everybody at some point. And, it doesn't have to be a lifelong thing, even with people with anxiety or with depression. Once they enter therapy, it does not mean that they have to be there for the rest of their life. I always tell people my job when they come into my office is to help them process, explore, question. But my job is also to help them learn how to think and learn how to identify their patterns. And that way, in the future, when they're no longer in my office, they have the skills and the tools to be able to navigate any problem that's put in front of them.
Well, one pivotal point that you also work with is in postpartum anxiety. And I think this is an interesting point because some people have never really had an issue with anxiety, but then after perhaps they have a kid that this is something that they have to deal with now. And so maybe let's describe what exactly postpartum anxiety is and your role in the things that you're doing with it.
Yeah. So postpartum anxiety is, it's pretty similar to regular anxiety, but it focuses on focuses on the health, the well-being, the behaviors of the baby. And often we see moms kind of focusing on their bodies and their health as well. And what we see in postpartum anxiety is a lot of thinking, a lot of sometimes behaviors, cleaning, a lot of fear. And one thing to note is that the postpartum brain is very wired to be in a heightened state of alert, right? Like after you have a baby, evolutionary wise, we're in this heightened state of alert. So we're watching out for our baby so the baby doesn't die. And sometimes that malfunctions and then it goes beyond what's actually useful. And then we're doing things that are actually creating more anxiety. And so it's just something that I think gets missed a lot because number one, I think it's very difficult for moms to admit like, okay, I'm not feeling well here. Yeah. And number two, sometimes it's really hard to notice because things like sleep deprivation, things like, all the focus is on baby, that sometimes it's missed.
Well, I'm sure you're also going through, the hormone changes have to be insane. It's got to be kind of a very eye-opening experience the first time you go through that part, and then also feeling that I'm sure it can be very confusing. Is like, is it all these emotions that I'm feeling? Is it the biological drives that are like making me feel this way? I guess like when is it considered that you have postpartum anxiety? Like how are you treating, or like when do you officially can diagnose somebody with postpartum anxiety?
Yeah. So again, that kind of goes back to when you asked about anxiety. It's right. When it becomes disruptive, when mom is feeling distressed, when she's feeling just like she can't control her thoughts, she can't control her behaviors. Maybe she's neglecting herself to, focus all on baby, because what we want to see is we want to see a healthy balance of, mom focusing on baby and focusing on herself. And, but with postpartum anxiety and postpartum depression too, a lot of the focus becomes on baby, all becomes on baby, and almost too much. It's like, oh, I have to change baby's diaper every hour or every 10 minutes, or I need to wash my hands, every 30 minutes. Or I need to check on baby all night so that baby doesn't stop breathing. And so we just see a lot of repetitive, almost excessive behaviors. And that's when we kind of say, okay, like this has been going on for a while. And that's when it's usually diagnosed. Because like I said, it can be very normal to be like, oh, is baby awake? Is baby breathing? Like all of us do that, I think. But when you're staying up all night and, washing your hands 30 times a day, that's when it's like, okay, we gotta address this.
How long after birth is it considered postpartum depression or anxiety versus normal? And are they the same?
Good question. So they say about 6 to 7%, I think, of pregnant moms get postpartum or perinatal anxiety. And then about 10% get it postpartum. And so sometimes you just have it during pregnancy and like it just continues and it just continues. So there's no like time frame, like, oh, it pops up at 3 weeks or 4 weeks, and that's when it's diagnosable. But with postpartum depression, I know you didn't ask about that, but this is a really important distinction, is there's something called the baby blues. And I think about 80 to 90% of moms will feel weepy and sad and just like sometimes just hopeless. And that happens from birth to like 2 to 3 weeks. And then after 3 weeks, typically we see the baby blues kind of go away. A mom's kind of getting used to her role and it kind of goes away. If she's still feeling extremely weepy, sad after 3 weeks, that's when we say, okay, this could be postpartum depression. So to answer your question, there's no distinction really that I know of for postpartum anxiety as far as like when it begins, but postpartum depression, there is that distinction.
Interesting. And how much of a role does support play in experiencing depression and anxiety after having a kid?
Huge. They actually say that. I went to a conference and a psychiatrist there who specializes in postpartum, he said that support is much more like of a factor in wellness than medication. So he was like, I could give moms all these different medications and they would do nothing if she didn't have support. And he said that support is way more powerful than any medication that he could give. So I think support is huge and it's needed. And I think it's something that should be talked about more, because I think that it's very natural for all of us to say like, oh, how's baby? Like, oh, let me hold baby. And I think focus should really be on like mom, like, hey, how are you doing? Hey, do you need a meal? Do you need to go take a shower? I'll hold baby for you. Do you need to go take a nap? Because those first 90 days, I mean, those first years after baby, but especially those 90 days after having a baby are so difficult, exhausting, emotional, and moms really need that support then.
And as you kind of started to talk about like depression versus anxiety, are postpartum anxiety and depression treated differently?
Yes, in that some of the coping strategies that I teach to moms with postpartum anxiety are different than postpartum depression. But support is definitely a common treatment for both. Like one of the biggest things that I do with moms when they come in is like, okay, who's your support network right now? And they're like, oh, like this person and this person. And I'm like, all right, let's call in all the people right now. Let's call in cousin. Like, do you have an aunt that maybe you can call in for a few days? Like, let's get your friends on board. Like, let's get everybody kind of helping you right now. And I'll do that with either postpartum depression or postpartum anxiety. They're kind of the same, but like the coping strategies are much different with those disorders.
Now, has there been an increased prevalence of perhaps single mothers, or at least mothers who don't feel like they're supported postpartum?
I haven't noticed that too much. I think that I hope that, single mothers have other methods of support, friends, family. But I do absolutely think that if there's no partner in the home to help, with baby, with young infant, that definitely increases the risk of a postpartum disorder developing, for sure.
Now, there's certain populations or people who are more prone to having postpartum depression or anxiety.
Yes. So if you have a history of anxiety or depression prior in your life and you have a child, yes, you are at a higher risk of developing it. Also, if you have a traumatic pregnancy, a traumatic birth, if you went through IVF, assisted reproduction to have your baby, you have a higher likelihood of developing depression or anxiety after birth. And then if there's a history, so if mom or grandma or aunt, they experienced it, then you do as well.
And another important part, obviously, of being a mother can also be breastfeeding. And so is breastfeeding a part of that postpartum anxiety? If they don't do it, they get it more often. I'm not sure what the numbers or what that would look like, but is there a link to breastfeeding and perhaps postpartum depression?
So I think that there is, in that if a mother chooses to breastfeed, that, and if it's difficult, like if baby doesn't latch, if she's not producing, then that's when we see a link. But as far as choosing or not, I don't think that there's too much of a link.
Gotcha. So even stressing over whether to give them the bottle or breastfeed is not really something that can cause postpartum depression or anxiety. It's not really correlated, so to speak.
Yeah, not that I see. It's just that if they do choose to decide to breastfeed and it's just not going well, then that can definitely play into postpartum depression and anxiety.
Now we're talking about the mother here, of course, but I'm curious to know if men can actually get it too now, and can they experience postpartum depression after the mother has had their kid?
Absolutely. Yes. Yep. And I think it's very, very undiagnosed.
And what is your experience with that? Have you seen people who've come in and be like, I don't know what's happening. I'm feeling really weird. I'm not sleeping. Have you had any patients and experiences working with these people?
I've never really worked with men that have experienced postpartum depression. But I do hear all the time from mothers that, my husband and this and that. So, and it's very, very common. Yeah.
And are there also mood disorders that can arise postpartum? We've been talking about depression and anxiety. Are there perhaps hormonal changes that could lead to mood disorders or other forms of mood change?
Yes. So there's something called postpartum bipolar disorder, postpartum psychosis, postpartum OCD, postpartum PTSD. And those are common as well, not as common as postpartum depression, postpartum anxiety. Symptoms. So postpartum psychosis is considered a medical emergency and it's very rare, but it's something that does happen. And postpartum bipolar disorder is similar to bipolar disorder in that there's a lot of ups, a lot of downs. What we'll see with moms who are experiencing bipolar disorder is she has a very low need for sleep. She's extremely energetic, has an extremely clean house, things like that. And then, she'll drop. So then it's like very difficult to get out of bed, very depressed, and you'll see kind of that fluctuation of up and down.
Now, say someone has anxiety or depression before the pregnancy. They have their pregnancy and then they get outside of, that 2 to 3 week baby blues area. They're experiencing symptoms that may be similar to that of their anxiety they felt before. I mean, are there discerning factors between anxiety that you normally feel versus after, conception? I guess, have you experienced that before? And like, how do you navigate like deciding like which is which?
Right. Yeah, it's very tricky. And they actually say that it can be considered postpartum anxiety, postpartum depression up to 1 year after birth. So if, let's just say mom's fine, and then on month 11, all of a sudden anxiety starts. We could consider that postpartum anxiety, postpartum depression. The good news is that anxiety in general, whether it's regular anxiety, postpartum anxiety, a lot of it is treated the same. So differentiating it is not a huge deal because it is treated very similar.
Are the brain changes similar? Or like when you look, perhaps if you're looking at anxiety in the brain, chemically speaking, with normal anxiety versus postpartum, are there differences hormonally?
So, right. So with postpartum anxiety, a lot of it does have to do with those hormone fluctuations. So that is different than, I guess, regular anxiety. So even though the cause is a little bit different, the treatment is still very similar.
Okay.
But with postpartum anxiety, we really focus on, different like topics like baby and mom, whereas maybe regular anxiety, we're talking about jobs and, relationships and stuff.
Now, for treatment options, is it difficult for people to get insured to come and see a provider to get access to a psychologist to get help? I suppose, like, what are the covered options for getting and seeking treatment after postpartum?
Yeah, so I think that there are a lot of opportunities to get mental health coverage covered by insurance. But I am seeing a huge wave of clinicians kind of getting off insurance panels, just because I think it is a little bit trickier, and it's a lot more time consuming for the clinician to be on an insurance panel. And often you're kind of restricted. Some insurances say, oh, you're only allowed 5 sessions with the patient and you got to figure it all out by then. And so it's a little bit more difficult now, I think, to find somebody covered, but it definitely is there. You know, you can go on your insurance website and type in your zip code and there's clinicians listed, though I think that those clinicians are their schedule's much more filled. So I get a lot of clients call me like, hey, I've called everybody in my insurance. Nobody's taking new patients. Are you? And unfortunately, I have to say, no, I'm not, just because of the reasons I stated earlier.
Now, why are insurance companies not reimbursing? I mean, if it's such an issue and it's making such an impact on these women and perhaps men and family members' lives, why are insurance companies looking at this and being like, okay, we need to help solve this issue with mental health issues and so on?
I don't know. I don't know. I wish I knew, because if they just reimbursed and made things easier, I think that a lot more clinicians would be on board to being on insurance panels.
And do you think that's a next step to get people to, or at least get insurance companies to really understand the mental toll and the suffering that perhaps people are undergoing?
Yeah, I think that, for example, when I first became licensed, I tried to get on a panel. I won't say which one. I tried to get on a panel, and I was told that they already had enough clinicians on their panel and they were not taking any more clinicians. And I explained to them that was very interesting, because I was getting calls daily looking for people looking for insurance paneled clinicians. And so, yeah, I think they just make it difficult getting on paneled and then getting reimbursed and all of that. So if insurance companies got more on board, I think it would make everything kind of trickle down and be a lot easier.
Do you recommend seeing a psychologist, even if you think that even if you don't have anxiety prior to having a kid? Do you think it's good to talk to a psychologist before having the kid, or just as a mental check to see like where you're at prior to your pregnancy and then obviously conception?
Yeah, I think it's a great idea. I think that, you know, women and families are asked to take prenatal vitamins, right, to be in the best physical shape to conceive. And I think it would be great for people to come in and do a mental health wellness check. Like, how am I doing? How's my stress? What's my risk? I don't know if you knew this, a lot of people don't, is that postpartum depression, anxiety is the #1 complication of childbirth. And so, you know, gestational diabetes, that's a big one physically that women have to go through postpartum pregnancy. But, you know, this is the #1 complication of childbirth. And so I think it really needs more attention, in that a lot of it could be prevented, right? Like things like what you're saying is just going in, getting a mental health check before, and understanding your risk factors and being prepared with that support right after baby's born, so that you're not having to ask for it. It's already there. It's amazing. In some cultures, they actually have it already figured out. Like, you know, the moms and the aunt come move in like for like 3 weeks after baby's born to help. Or, you know, for 90 days, the mother's just supposed to rest in bed, and she's brought soups and she's brought her baby to breastfeed. And then the mom and the aunts take care of the baby. Like, in many cultures, they have it figured out. Here in the United States, it's like,
Good
have
luck.
your baby and go figure it out. You're like, wow, it's really, really bad.
Are there communities that are online or resources that you've found that people can maybe access to get that support? Obviously, in-person support would probably be the most ideal, but for those who maybe not have that support or community around them, are there online resources that people can access?
So there's a really, really great organization called Postpartum Support International, and they have like everything, like virtual support groups, in-person support groups, a lot of information. You can even call a hotline. There's a text line. Just if you don't have that emotional support, you can just have somebody to talk to, and they have all kinds of resources. And so I think that's a great resource.
And you mentioned it's the most important, like the number one risk factor of having a pregnancy. Was that the motivation for you to start your own practice and to get out in the world and to help people?
So I actually was inspired by my own personal life. So I have 4 kids, and I experienced postpartum anxiety and depression with three of my kiddos. And I think that's during that time, especially with my first child, he was born 9 weeks early. And so he was in the NICU, and I was a super young mom. I think I was 20. And it was just really, really hard. And I remember feeling so alone, and I remember trying to get help. And there wasn't really anybody very specialized in postpartum. And so they didn't really know how to help. And so I just kind of floated around for a while and put myself in my studies more and tried to figure it out myself. And I think that really inspired me to say, like, all right, I want to help moms. And I've been through it 4 times now. And so I think I have a very good understanding of what it's like to be a parent, and also clinically wise, like I trained a lot in this. So I think that's what inspired me to do this.
Well, one thing that I do now is actually reach out for other resources to try and make myself better, exercise programming wise, because sometimes you have your own blinders on. You kind of be your own worst enemy in that regard. Did you have success with seeing a psychologist, and do you continuously work with one as well?
Oh, yes. Yes. I see a psychologist regularly. Yes. Because, the amount of stories I hear, the amount of troubles I hear, I try to stay mentally healthy, and then I kind of go unload on my psychologist. So, and I just think it's good. Like I said, I have this growth mindset of who I am today is not who I'll be next year. And I think it's very important to have that place to go and vent and process and, talk about difficult client stories. And because I really do care about my clients and the things that they tell me, it's hard to just kind of leave it and be like, cool, if that happened to you. Like it does affect us.
Yeah. Sure. Have you had to adopt this like leave it at work method, or maybe not as harsh as I put it, but I mean, has it been something that you've had to practice?
Oh yeah. Yeah. At the beginning, when I was first training, it was, oh yeah, I was having a hard time. I was crying a lot, like thinking about my client stuff. And now it still absolutely does affect me. But I have to kind of compartmentalize and say, okay, like in order for me to be a good clinician, I have to be mentally healthy. In order for me to be mentally healthy, I have to put this aside for now. And that, I can send good thoughts their way, but I can't keep thinking about it. So it's hard though. It's hard because I'm a person and I have empathy, and you hear stories and it's just heart-wrenching.
It's very difficult. And I did a clinic at one of my internships down in Florida, and I was in a long-term acute care hospital. And some of the things you would see, it was like that first week. I remember I came home, I was like, all right, I'm going to have to create a barrier here, because I'm not going to make it through these 8 weeks if I don't establish a fine line of like work and outside of that.
Yeah, for sure. For sure. And, I work with moms, and there's a lot of loss in that, right? There's a lot of like pregnancy loss, infant loss, child loss. And personally, I think that's one of the most difficult things that somebody can go through is a loss of a child. And so I see that a lot, unfortunately.
Well, that has to be, I mean, having 4 kids of your own and being able to empathize in that way has to be something that's got to be extremely difficult, and trying to navigate that. And is it considered like postpartum depression after that? I'm not really well versed in that area. I suppose, like, what are there like different diagnoses with people who've lost a child during pregnancy?
Yeah, so it's tricky there. Things start getting really, really foggy and blurry there, but it could be considered a postpartum PTSD. It could be considered just plain old grief. I think that there's a natural response that happens when we lose somebody, and sometimes pathologizing it is not the best. Like, it's just like, no, you're grieving right now, and that's okay. And you're going to grieve for a while, and we don't have to necessarily put a label on it. There's nothing wrong. But yeah, it's very, very tricky. The whole diagnostic label, I think, is very useful, but sometimes I'm not big on it, to be honest. I'm not big on saying, oh, this is what's wrong with you. Like that's your label.
Yeah, even as I was saying, I'm like, this doesn't just, it just sounded like sludge coming out of my mouth. I'm like, this just doesn't sound right. But I was trying to, say it in a way where it's like, there's you need to acknowledge that there's something wrong with your day-to-day life and you need to seek help. And I'm sure there's a lot of women out there who may not feel like they're getting the help that they need.
Right. Yeah. And I think a lot of women, they want to, they feel like they have to stay silent. There's a lot of shame and there's a lot of stigma attached to admitting, like, I'm not doing well right now. And here I am supposed to be taking care of another human and I'm not doing well. And then there's a fear, like, if I admit that, are they going to take my baby away? Um, and, one of the biggest things for me is after I experienced it for the first time, I opened up to a friend and I was like, I'm not doing well. I'm not doing well at all. Like, my baby cries all the time. I'm exhausted. I didn't know motherhood was going to be this hard. Like, I'm not doing well. And I just remember feeling so much better after that because my friend was like, okay, like, I'm sorry, like, but okay, yeah, I've totally been there too. And then, like, that shame kind of went away. And so I think that the more that moms can open up and talk, the less shame they'll feel. And I would say 70 to 80%, maybe even 90% of parents, mothers, fathers, like, it's just hard. It's just hard. And there's days where we don't want to do it. And there's days where you're like, what did I do? And it's hard. And that's okay to admit it. We're all thinking it.
Certainly, I I've seen it time and time again where, like, you're in a grocery store and you see the kid crying and you just, like, the dad or the mom's just like straight faced, like, why, what have I done to myself? They're trying to figure out, like, what's going on.
Yes. So I think the more we can just be open, the more we can admit, like, it's just, we're going to all feel a lot better.
Yeah. And being open to it, much like how, anxiety and depression in and of itself has become more normalized. I think that also needs to be more normalized, as having conversation and checking in on your friends. Like you said, I think that's also a very important point. Like, not just ask how the kid is, because more or less they're probably doing okay. It's like, how are you doing? Like, how are you feeling? How are things going? What help do you need?
Yep. Exactly.
I'm curious to know, like, what are your goals? What are your aspirations for the future with perhaps your company, as well as also learning more about postpartum anxiety, depression, helping people? Like, what are some of your future aspirations that you hope to accomplish moving forward?
Yeah. So I have a couple. I feel like I always have to quiet them down because I always have so many dreams and goals and stuff. But two of the biggest ones right now is I'm working on an app. It's a mental health app. And it really, I think, hopefully will change kind of the way everybody perceives mental health, talks about it, communicates, helps people through it. And that's called Sphere. It's hopefully going to be out sometime next year, but I've been working a lot on that. And then another thing that I really want to do is I want to create more mental health presence in the hospitals. So after somebody gives birth, you have the lactation consultant coming in, you have dietitians coming in, and then you get this piece of paper that says, how are you feeling? Have you thoughts about hurting yourself? And, like, you sit there and you circle the questions. And then you give it to the nurse and they look at it. And if it's scored high, then you might get oh, you need to call a therapist. You're showing signs of this. But there's a lot of problems in that, right? Because a lot of moms are not going to be truthful.
Mm-hmm.
I've seen a lot of moms fall through the cracks as far as they score high and then what? And then they're given, like, a referral, and then they call the referral and they're full. So what I want is I want mental health clinicians, psychologists, MFTs, social workers. I want it to be totally normal, where almost like they come into each room after somebody gives birth and they're like, hi, I'm Lisa and I'm a psychologist, and it's hard to have a kid, and here are a few symptoms to look out for. If you start feeling it, give me a call. I'll check in on you in 3 weeks and let me know. And then especially with the moms that had a traumatic birth, or their kids in the NICU, or maybe they had a difficult pregnancy, like, those people really need to be visited. But I would love for that to just be a normal thing. I think the rates would go down. And, with postpartum depression, postpartum anxiety, it trickles down. So if mom is healthy, if parents are healthy, they're going to have healthier children,
Right.
right? Like if somebody's struggling and they're in their room and, baby or child is maybe not getting the attention or nurturing and that they could benefit from, it just trickles down. Those children grow up to be maybe more anxious and more depressed, and it just keeps going. So my opinion is that postpartum depression, mothers, parents, like that's where we should focus a lot of attention on. Because if we can get to them, it just trickles down into the community.
Like, why isn't that not a thing though? It just sounds like so simple. You're like, I don't know, it makes so much sense and it's still an issue.
I don't know. I mean, I'm even to say like homelessness and drug abuse and like all of those things can like be solved by focusing back on moms and dads and saying like, how do we get them healthy so that they raise really healthy people?
Yeah, because all those issues are at least our conversations as well. So it's certainly, hopefully somebody's listening to this and is like owns a hospital, like helps within the hospital system, is like, listen, we got this new plan that we're going to put in place. Everyone's going to get the help that they need.
Exactly. Yeah, I'm hoping within the next year I can hopefully get into my local hospitals and maybe like do like a pilot program and be like, okay, look, like see how it works, like, have data and all of that. So that's my hope.
Well, it's certainly exciting. I really appreciate you taking the time out of your day to answer all my questions and also help other people who may be going through the same thing. I just have a couple questions to end off the podcast. These questions are the health me to health you portion, and you had a little bit of time to look at them, so kind of prepare your answers. But first question is, if you had the attention of everyone in the world for 30 seconds, what would you say?
So I would say that it's okay to have a mental health, that it's okay to feel angry and sad and frustrated and fearful and jealous and all of these things. And that the more we can acknowledge and we can articulate, so we can tell people how we feel, we're just going to be happier, healthier people.
Well said. What book do you recommend, whether a book you're reading now or in the past?
So I love anything by Brene Brown. She talks a lot about shame and letting that go and just kind of living authentically. So I would say anything by her is amazing.
Last question. Where can people learn more about you or what we talked about today?
So they can go to my website, drlisaslover.com, or they can just, I think, Google my name and you'll find like my Instagram and my Facebook and all of that. Yeah.
Lisa, thank you so much for coming on the podcast. I really appreciate it.
Yes, thank you so much for having me.